Very good evening to everybody, and welcome to the 47th episode of Eclectica The Different News. Now that we know that we are conducting a special series inside Eclectica, that is the Dental Scientist series. Well, then, if you are here with us in the live session or if you are watching the recording, anyways, you are most welcome to give us a hi, hello, and that gives us inspiration. So, today I have an awesome and fantastic academician, my guest, and she's a fantastic researcher. And today, with the cup of coffee which is lying beside me, let me introduce my guest first. And I'm sure that you will love this introduction and love our conversation because today we will be talking about something very, very interesting and which is not much spoken of in dentistry, that is understanding dental research. So well, just see that what a guest I have got today. So we have Dr. Pragati Kaurani, who did her MDS in prosthodontics from Bharati Vidyapit Dental College, Pune in 2006, and she is currently pursuing her PhD in prosthodontics. She has been working with Mahatma Gandhi Dental College and Hospital, Jaipur since 2007. She has guided several postgraduate students in their research work. She has done to do a distance learning course on research methodology from the Public Health Institute of India in 2017 and a course on qualitative methods from the University of Amsterdam through Coursera. She has authored a book on research methodology in dentistry that was launched by the then Honorable President of Dental Council of India, Dr. Majumdar, in 2020. She has several publications to her credit and has authored chapters in books. She has been invited as a guest speaker at various national conferences and has conducted courses on research methodology. Recently, her research on nanoparticles in denture base resins has received a research grant from the Department of Biotechnology, Government of India, and her postgraduate students' research on dental implants has received a research grant from ITI India Head. Her scientific paper at the 43rd National Conference of Indian Prosthodontic Society won the prestigious Dr. G.C. Das Memorial Award in December 2020. She served as the scientific chairman for at the 43rd PG Convention of the Indian Prosthodontic Society in 2021. She runs a Facebook page on research in dentistry that has around 550 members across the globe, where she regularly shares various aspects of dental research and scientific writing. She is a reviewer in the Journal of Indian Prosthodontic Society, International Journal of Dental Sciences, and associate editor at the Enviro Dental Journal and guest editor at the Frontiers of Oral Health. I think that's overwhelming information about our guest, and I'm very happy to call her in because she's waiting at backstage. Very good evening, Dr. Pragati, and thank you for accepting my invite and coming here inside the special series of dental scientists inside Eclectica. I welcome you and thank you once again for being here.
Thank you, Dr. Gargi, for this wonderful introduction. Those who are interested in research would find the introduction very interesting, but those who are not would find it rather terrifying. So, but thank you nonetheless, and for giving me this opportunity also, so that I can share my little experience, hardships, and achievements with all your viewers and yourself.
Thank you. I think I have a lot to learn today from you because this is very interesting thing and this is something which is very close to my heart because similar to you, you are into the hardcore academics. I am in the juncture of academics and industry. So I do promote about oral healthcare research because this is something which we really need to look into. And instead of lamenting about dentistry or procrastinating about why did I choose BDS or MDS, so I think you are the best person who can enlighten all of us in these aspects. So yes, uh, I think we will just get into the session because what I have is lot of questions to ask to you. So as you mentioned that you want to share your hardships and challenges, that caught my mind. So my first question is that, like, what are the top challenges for a dental student when it comes to research in dentistry? What do you think, because you have been in academics for a very, very long time at this point?
So, since I am teaching both undergraduates and postgraduates, both of them have their set of challenges. Undergrads have the biggest challenge that dental research is not introduced into the undergrad curriculum by the Dental Council of India as of now. But I'm very happy to say that, I do see students coming up here and there. They have their interests because the books here and there mention something about research which clicks to them and attracts their attention. So they do come up to me because they do find it intriguing. At the
Mm.
same time, it's very interesting to mention here that ICMR funds the STS, that is short term student research work, which encourages undergrads to take up research. So,
Mm.
with this little ignite, it's much better, and I'm sure it will keep getting better and better. There are other small schemes also for undergrads. We'll speak as we move on. But the biggest challenge for undergrads is basically that research is not introduced to them. They are still
Right.
battling the basic subjects. So research is, one step ahead. So that from where to start, that is a little bigger issue for undergrads. For postgraduates, the issue is slightly different because they already have the base as they are, they've passed their graduate degree. But
Mm.
their challenge is what research topic should they select? So I
Correct.
speak on so many platforms, and the only question that these students come up and ask me is, ma'am, how do we select a research topic? And that's the first hurdle which they are supposed to cross, and it's right in the beginning of the first 6 months of postgraduate curriculum. So this is one of the biggest hurdles over there. But as they progress, the postgraduates have guides to help them through.
Mm.
So that makes the journey a bit easier for the postgraduates. But unfortunately for undergrads, I think the journey is a bit longer. So
Right.
these are the first basic challenges. The second challenge refers to the infrastructure that we have. As much as I would want to do a great research, your city may not have that testing mechanism, your country may not have that testing mechanism. Eventually we'll end up settling for something lower level, and that lower level doesn't give you the publication that we try to aim for.
Mm.
So
Mm.
it's a hurdle which is slightly beyond the control of anybody. But I'm sure with time, as things progress, they're better now and things might get better. But essentially, these, infrastructure funds and where to start, I think even a smaller topic, even if you chose a topic that doesn't need too much funding, but the basic hurdle that a student encounters is, how do I start? What topic do I select? So that is something which I feel is one of the biggest hurdles for the fresher, someone who's new into this.
True. Thank you. I think that's a very practical insights that you gave us, because you are dealing with students, both UGs and postgraduates, day in and day out. So I think these are very practical problems, that the challenges that you have, you face, and I think you yourself have to solve those problems as well. So in the same context, another aspect which I have seen also, like as you said, that some students, they one part is what you said, is that there is a little bit of we need to improve on the infrastructure, or maybe funding, or even guiding them, or telling them, okay, this is how you should do. So but there is also another part which I see, that or I have learned from several other eminent minds, that many faculty tell me that, ma'am, like, doctor, how do we encourage them, because students are not interested in doing dental anything in research. So do you face any challenges similar to these, to motivate your students, or and if you have faced such challenges, then I mean, what how do you solve these things, because I think this is kind of a daily thing for you in your profession. Yeah.
Yes, yes, exactly. So, the students see we are somehow trained in a very, a set pattern, because we are trained just to do dental practice. That is how things are taught. That is how we were taught, and that is the essential core of our profession as well. So there's nothing wrong in that, as a faculty and dental colleges focus on dental practice.
Mm. Mm.
But not giving any platform to them is something. It's just like we've shut an entire route or a journey to them. So
True.
definitely that is an issue where students do not get encouraged simply because they are not exposed to something like that. So in my aspect also, these issues come where my students are not aware, especially undergrads. For postgrads, so they have a dental, a thesis as a part of their partial
Right.
fulfillment of
Mm.
their degree. So it works for postgrads. It's the undergrads which, there it is the a little issue where they are not really motivated enough or encouraged enough for this, to take this particular set path. But this challenge can only be overcome by faculties who are teaching,
Right.
because the more we refer to research work, quote
Mm.
research work while we are teaching,
Mm.
give them evidence-based understanding, tell them the significance of evidence-based. That is where things can start changing and rolling. And I speak on a lot of platforms. I speak on my national platform. This time I went to college, I address students over there. And everywhere I tell them one thing I think which works for them,
Mhm.
grabs their attention, is that, Cochrane is this network which is working on evidence base.
Right.
And as practitioners, one might think that what is the significance of research in their lives? But
Mm.
Cochrane has started providing information to patients also. That means they simplify scientific data so that patients can access that data and take a evidence-based decision on their treatment.
True.
So this concept will slowly come, and Cochrane has its, it's got its tentacles everywhere. We have a Cochrane India network established very recently. I'm a part of their oral health network. So what
Fantastic.
will happen is they will have a database which the patients will also access. So it's
Mm.
not that research is going to be cut off, shut in some books and things like that.
Right.
And
Right.
patients may not just go to Google and search. They will go to an evidence-based data and
Mm.
find out whether A implant is better or B implant is better. Should they go for two implants or should they go for four implants? Now, if the patient coming to your clinic is somebody who is knowledgeable on a evidence which has
Mm.
been published by a very high level of scientific literature,
Right.
obviously you as a practitioner need to know better. So,
Correct.
so it's not that the practitioners will not get or should not get exposed to this. This
Mm.
particular aspect of evidence base is what we need to. It needs to penetrate to the grassroots level of undergrads as well. And once that happens, that's when they will start taking interest into that. So that's definitely there.
Mm.
Other than that, like I mentioned, this very STS which has started, and they have this time I have noticed that the STS has increased the number of topics for dental students. So there
Yeah.
is epidemiology, there is clinical investigations, there is a lot of there's an entire Dropbox of topics which the students can select.
Mm.
Previous to this, there was only nutrition, mother and child care,
I know.
geriatrics, these kind of topics. Now they have prosthodontics, oral surgery. They have all topics included. So
Right.
we can, as faculty, encourage our students to apply for these kind of grants. You may not get the grant, but at least with that, that
Yes.
seed will be sown into their minds, and faculty should encourage them to go ahead and do the research irrespective of the grant or not. So I think
Mm.
this is what we have started, at least I have started in these last few years, and
Amazing.
that's how it's going to work at the student level.
Very nice to know the way you are doing at your individual front, because I think with small, like as we say, the drop by drop, the sea is formed. So I think this kind of things, this kind of attitude also needs to be instilled in the faculty front as well, because as as the UG student is coming to the next PG, and then ultimately they only become faculty. So I think as you said about the students, as well as I mean, if eminent minds like you, I mean, there should be an effort to encourage faculties as well, because it is also for many faculties, particularly who are just joining as a faculty, maybe they don't have much experience, so I think they are also not exposed, or they also don't know what should be the pathway to guide a particular student, because that is also very important. So I think it's an excellent way that you have taken things up, and the way you are take it, training your students. I think it's amazing, it's fantastic. So since we're talking about dental research and understanding dental research, so I think this is a straightforward question as per the topic. So what should be the correct approach towards understanding dental research according to you?
So this is a very, few years ago, if you would have asked me this question, I would have had no answer. But today, today, luckily, there are courses available online. There are
Right.
books. My own book is there as a reference for people to start off with. There
Hmm.
are very good courses which are available, and
Hmm.
many of the national conferences of
Hmm.
all societies has started pre-conference courses, additional short courses, and focus upon research and overall improvement in the research. My society journal, the Indian Prosthodontic Society journal, which is our national journal, they conduct a regular, small short-term courses for reviewers so that their method of reviewing and researching improves. So if someone is really keen onto it, you go online and search for good courses, like
Correct.
I did from this public health. It was a 6 months course. It was an online course.
Hmm.
Now you have a very a fantastic course by ICMR on Swayam portal. It is free for everyone to access their material, and
Hmm.
then you pay a certain amount and appear for the exam and clear their exam and get a certified degree from, I mean, certification from the Indian Council of Medical Research on research methodology. So now there are a lot of platforms. I'm sure if you go to Udemy, you'll go to Coursera, you'll find a lot of other courses which might be of your particular interest.
Hmm.
Not only for those who are into clinical investigations, if you are someone who's as keen as me on secondary researches like systematic reviews and meta analysis, you have a lot of fantastic online courses which are happening, which you can attend, starting from 3 days to 6 months courses within India as well as abroad. You can get a very good course like from JBI Australia. You can get it from P Value, which is a company held in Bombay. Pune, I think they are also giving a systematic review course. So these courses definitely equip you, and sitting an online course is good enough for you to get your basics clear. And without these basics, it's impossible to go ahead with research. That is for sure. So
Right.
now there are a lot of good avenues, and for those who want to grab it, there are a lot of good opportunities out there.
Thank you. I think these information are very valuable information that you are sharing, and I think whoever is watching this video, if you are a student, if you are a fresher, even if you are early practitioner, or even if you are already into the academics, so I think all this information you can search it out, and I think it will again add on to your I mean your knowledge base, and it will empower you. So thank you so much, Dr. Pragati, for such a wonderful information that you shared. So like one question runs in my mind, Dr. Pragati, because I talk about interdisciplinary, something which I that is very close to my heart. I always talk about interdisciplinary research, and particularly, definitely, my focus also comes to dentistry. So, and also if we see that our clinical practice, or even the curriculum, it is interdisciplinary, right? So do just like we have interdisciplinary clinical practice, do we also have interdisciplinary research in dentistry? How, and if it is existing, if anybody is interested to take up, so what is your opinion, how somebody can go about it? What do you think about it?
Oh, definitely. Interdisciplinary research is the only way to go about. In fact, teamwork is the only way to go about research, because otherwise you have just one kind of mindset. You don't see the problem from different aspects. And let's face it, we are ultimately dentists. We are not the kings of knowledge of all. And but we also have a very fantastic field which has an overlap of so many other fields. So
True.
when I do a research work, if the topic is about nutrition, I
Hmm.
ensure there is a nutritionist in my team. If I am
Mm,
doing nanoparticles, I ensure, if not in my team, at least someone is just a phone call away, so that at least I can ask that person that this is where I've got stuck. Please tell me how we can go about it. If it is a topic with psychology that is involved, I
mm,
do have psychology department researchers who are attached with me, because they give that kind of insight which I as a dentist cannot thinking too.
absolutely.
So the way to go about is that you crack your topic, and
Mm,
you see what are the aspects of the topic which can involve people from other fraternities. Approach those people, and it's just one mail away. Let me tell you this: you approach a researcher, there are just two ways they answer it, and this is even internationally, because I collaborate with a lot of them out there. If they are overburdened, they politely refuse, and they say, I'm sorry, we cannot go ahead. And if there is a slight chance that they can contribute and they are interested in your topic, they agree spontaneously. I mean,
correct.
I'm yet to come across researchers, because I do think that this field is like this. It's so exciting, and we all know that we need to hold each other's hand as researchers. So
Absolutely.
yeah, it's amazing. So now I will initiate this research. It's been 2 months, it's been just dangling on, and this particular research has researchers from, and I have already published with this team. So we have researchers from Sri Lanka, I have from Nepal and India, and Pakistan joined in this research, not in my previous one. And the we are following the lead article, which is written by somebody who's in Britain. So we approached her, Dr. Allen, and she agreed immediately, because her research was on developed nation, that is United Kingdom. So she was very excited to take it down to the developing or emerging countries. So now
Mm,
we've all teamed up. So she will guide us, because she's the main lead who had written the original
correct.
article. And we are all neighboring countries of similar cultural backgrounds and economic development status. So we
Right.
will collect data and we'll work together. So, and it's also very exciting, because you get different inputs of different people who are expert in their own fields.
Mm,
So interdisciplinary approach is in fact the best way to go about any form of research that you do. The end product comes out far better, far polished, and the level of scientific evidence comes out much better. So
mm.
definitely look out for teams, and everyone out there who's in this research world is as keen as me. So it's just one mail away. It's exactly
Correct.
as much as that.
Correct. So I think you just spoke my mind. I mean, this is something which I also believe, and this is something which I also try to propagate through whatever I do. But I think this is something which we also need to make people understand, whether students or who are, as you said, that we are trained in a certain way. So, we need to just widen our perspective of seeing a particular thing. And second thing, as you said, that approach. Just somebody either three things can happen, as you said: either they will tell no, or they might not respond, which is very very rare, or they
Hmm.
might agree. So I think it's kind of a probability game that can be played, because there's no harm in doing it. And
There's no harm.
fantastic, I'm so excited to listen to the way you are taking things forward, and the way you collaborate, and such a good you are doing such a good evidence based work. So because this information, when it comes out through your research or this entire teamwork, it will be a fantastic contribution to science. And with that, maybe, we don't know, next day we develop something which would be really beneficial to the society. So I think amazing, amazing, doctor. So you talked about your book, so we are very excited to know about it. So please tell us more about your newly launched book, and what exactly was your vision, or is your vision of with your book?
So the concept of book came because there was a lacune. The
Mhm.
lacune was because back then, even now in the market, whatever books on research are available, those
Mhm.
books are available from the medical people of the medical background. And there's obviously research methodology is the same, whether it's in medicine or whether it's in dentistry.
Mhm.
It's not different at all. So it's not that it has changed. But you
Mm.
know what? When I used to read those books, they used to give examples to explain a particular test or a particular concept. And that example was from the medical side, which I had no idea about. It could
Right.
do with child labor or, hypertension, some technical aspect of medical background. And I couldn't understand what was the relation that they are talking because I didn't have the base. So I realized that there could be others like me who struggle because there is
Mhm.
no, we can't understand the examples that they are citing. So
Correct.
that's when I thought that even though the basic research methodology is same, yet it is slightly different because we have so much of, like in prosthodontics, we have so much of lab-based studies. So
Yes.
essentially we could be same but we are still different. So, and more so importantly, there are if I cite a simple example, connecting dental caries and diet, you'll
Mm.
understand, rather than hypertension and some drug which I must have studied in second BDS. So
Right.
that gave me the inspiration to start. And that was after the course that I did, and then I wrote the book. But it's not singly written by me. I approached a lot of stalwarts in dentistry. There are some very, very good authors, heads of departments of different colleges whom I approached, who have contributed and who are more knowledgeable into this field. We gathered data, we cited examples from the latest literature so that students or readers could get a better insight of the concept of research methodology, citing dental examples so that it's easy to relate to. And towards the end, we have one chapter of each branch, which gave them the insight of what is latest in research from prosthodontics point of view, from conservative dentistry, orthodontics, and so on and so forth. So we have some, it's a compilation of some fantastic authors who contributed, and I thank all of them who helped me to develop that particular book. So that was how that book came. Somehow, at that point in time, we had a national postgraduate convention in my college where Honorable President Dr. Das was there, Majumdar sir
Mhm.
was there, and so that and they were excited about the book, so they launched the book. So it got its given platform. It's available on Amazon, and wherever I go, people take it. I mean, it's not a very commercial book because it has its limited market, but
Mhm.
what it works upon is giving you simple language of research methodology, and most
Correct.
importantly, not talking about child stillbirths and smoking and lung cancer, but it
Mm.
talks about dental caries, periodontitis, things like what you and me can understand. So that was the gap, and I tried to fill that gap through this book.
Amazing. I think since it is available in Amazon, so I think I will get the link from you once our live session is over, and I will put this link in the description of this video. So once this is a recorded version, you can get a hang of this fantastic book if you are interested in dental research. And I'm sure that this book is going to open your mind. And as we are going into this conversation, I think time is just flying because it is so interesting to learn from you, and this interaction is amazing. So I think I will catch you another day for some more some more chit chat, because we are almost coming to the end of our conversation, which is not very good because this is something which I can just talk about hours together. So yeah, so I think you have done a wonderful job already. So in that way, supposedly, if somebody is interested to take dental research as a career, so you being a researcher and avid academician, so can you summarize top five do's and don'ts when it comes to taking up dental research as a career?
See, the do's start from the very basic. The
Hmm.
first thing is to get the basics correct. I've learned it a little on the hard way, and I think I'm still learning because there is no one there out there to guide me. But just going out there and starting may not be the best thing. So getting the basics, which is not really taught in our college, so getting the
Hmm.
basics right is the first and foremost thing. The second thing I speak about on all platforms is, in prosthodontics, we have this concept of prosthetically driven implants, We keep the end point in mind and then place the implant according to the occlusion. So, when you do research, you should have the same concept. You keep the end in your mind. Will this particular topic get published tomorrow in a good journal or not? Is this researchable? Is this readable? Is this what people want to look out for? So keep the end result in mind. It may be very nice to do a research, but if it's an obsolete topic, then it still doesn't work. I mean, all said and done, no one will read it. So keep
Hmm.
the end result in mind. The third thing is keep looking for funding opportunities. See, today's story is very different from what it was previously. Today, in all grants which come out from the Department of Science and Technology, from the Department of Biotechnology, from ICMR, there may be pockets where we fit in somehow.
Hmm.
We can
Hmm.
manage, because we fall into areas. Last time ICMR had a huge list of topics under saliva itself. That's quite
I know.
interesting.
Yeah,
Yeah.
yeah.
So,
I know.
so that's how the saliva research was boosted, I believe. Nanoparticles,
Hmm.
somehow nature base fits into nanoparticles. So somehow, somewhere in some particular format, artificial intelligence, geriatric, nutrition, psychological effects, trauma because of traumatic injuries, they do fund trauma, chronic diseases. So look out for opportunities. Look, because there could be some pocket in which we try to fit in. Whether we get or not is a different aspect, but it gives you an insight that yes, you can fit in as well. So look out for opportunities and apply for these opportunities. You will only learn with time how to do that because it's a tedious process. But just keep browsing these websites will help you understand what is it that the government is wanting and government is funding. So that itself is a very good innovation that or a practice that you can do. The other thing is develop an analytic mind and a critical mind. Don't accept whatever is published just because it's published. Ask the question why. When you start connecting the dots on whatever interests you, then your mind starts thinking in the term of a researcher, because there's a shift from a researcher to a clinician. So you need to develop your mind frame in that aspect. When you're a clinician, you're just bothered about the clinical work and things like that. When I'm a researcher, then your mind shifts slightly to more evidence based.
Hmm.
Why and how can we prove this, how can we disapprove this, is it
Right.
statistically significant or is it not statistically significant? And lastly is of course develop a good team, get a mentor or a team, because without the team, definitely, even if it's a systematic review, you cannot do it. So you need to
Correct.
have like-minded people with you, around you, develop those kind of contacts who can help you out when you're stuck. And it could be a junior, it's not necessary to have a senior person above you. I have a lot of enthusiastic colleagues of mine who are way junior to me, and if I give them, okay, just find out this particular article, they go and do the finding, and they're like, yes, yes, we can do this, we can do that. So it's a teamwork. Research is
Correct.
a teamwork. Thinking ki mera idea koi le lega, someone will take it away from me, it doesn't really work in research,
Yeah.
because an idea is just the start of it. The end is really really far away from just the idea. So those are the five do's. And there's a big list of don'ts also. And the first one is ki don't be impatient. Research work is a very gradual, slow. It takes 2 years, 3 years. I mean, it takes time before results start pouring in. It might be time before your publication list increases. And I tell that to myself because my publication list is also not that high. So I say, yes, okay, I'm at it, I'm working. It will take its time, but at least I'm working. So we need to be a little patient in research work. We
True.
we also need to understand that there's a paradigm shift in our thought process as a clinician and as a researcher. So if you keep the same thought process, then I don't think research is your cup of tea. Yeah. So you should be ready to take that leap to the other side. It's very difficult to be a clinician and a researcher at the same time, because research itself is a lot of uh,
Hmm.
you know lot of mental space. Basically, physically it's not, but mentally it takes a lot of space. So if you're not there to put in that kind of 10 hours, sometimes 12 hours of work, that is writing, typing, finding, searching, then you really need to think what needs to be done. Also, I would want at this platform to highlight the presence of predatory journals. So don't fall into predatory journals. It took me a lot of time, and I've wasted a lot of my research work in my earlier years because I didn't know that there is a predatory, a concept of predatory journals. Back then, it was just a journal, so we just published it in a journal. Then slowly came out the concept, no, it should be only PubMed, it should be only Scopus, it should be only this. But I had already published some three, four of my research work in the initial years in
Mm,
journals, and one on two of them were predatory. So I want to warn those who are starting, because no one warned me, and I lost two, three of my research work to these predatory journals. There are
mm,
definite ways, and the government of India has come out with a list also. There's a website of predatory journals also. So don't fall into easy prey. I see my postgraduates also doing this. Ma'am, 3,000 rupees, 4,000 rupees.
exactly.
Yeah, it's tempting, just give away 4,000 and get done with your publication. But the
True.
publication is the real laddu, you have worked for towards the end. But
Correct.
postgrads think that bus submission of thesis is the end. It's
And
not. It's not actually. So please beware of predatory journals. Look out for them. They are just there to eat the money, and it will
mm,
be in the dustbin. All that work of 2 to 3 years. Also, do not this is for some students and maybe early career researchers who are there. Don't leave it just at submission. So finish publication, let the world know what you have done. If
correct.
it's not a very great research work which cannot go into a very big journal, fair enough, settle for
Mhm,
a smaller journal, but don't let it not get published. Please publish it so that people read it. It is out there.
mm,
Just today I posted my Facebook story about my postgrad student who did a very small research work. His part of his research work was published in a small journal, and I
mm,
put it up on ResearchGate. And today morning I found on my inbox, ResearchGate said that my student's research work was read 600 times. So it gave me a congratulation, and so I just felt so nice that at least there were 600 people who read a very simple research. It was a simple research, but it was read by people and
mm.
recommended by one and cited by one. So great, why not?
Nice.
Yeah, it's great. It's out there for people to read, people to see. So even if it is a smaller journal and not a predatory one, because there's a difference between the two. So
Mm.
not a predatory one, but may not be like a very good, a very great journal
Very
out
high
there.
impact factor kind of a thing.
Please,
Yeah.
yeah, don't leave it unpublished. Please publish your research work. Don't pass out and leave the thesis ki baad mein dekhenge. It never gets published. So do it as soon as you finish your work. And most importantly, there are no shortcuts. Just there are like no shortcuts in this world. There are no shortcuts for sure for research. It takes its time. It's a cake which needs to bake, so it will take its time, and we are patiently waiting there for it to finish. So these are my little do's and don'ts for those who wish to take up research work either in their academics or even as a career.
Fantastic. I think this is very, very insightful, and I think this is a very valuable information, very practical information that you gave. It is not kind of theory, and I understood that where your enthusiasm, your inspiration
Yes.
comes from. Now I understand very well, because losing a research, I
Oh
mean,
yes.
that is a very, very, I think is as equal losing your very close one, or maybe a baby kind
Yes.
of a thing. That's kind of a pain. The researcher's mind will understand that very well. So
Yes.
I understand that that is how you have evolved. And I think if people like you, or we can actually motivate people in the way you have seen the world. I think it is the scenario is going to change very, very, very soon. So it's not future anymore. So coming to the last question, Dr. Pragati, it was actually wonderful speaking to you today. That what would be your message to young aspiring dentists regarding oral healthcare research?
Oral, well, yeah, very interesting because oral health care research is a vast topic. It's a huge thing. You can work on oral cancers. There's a lot of funding out there on oral cancers. You can work upon quality of life based patient reported outcomes. You can focus on material sciences. I know of people who worked on nanoparticles denture bases and then shifted their line from dentistry, got into the industry of polymers. They were picked up by companies who required researchers on polymers. So it's not essentially not our mainstream, yes, but one researched on it, one worked on there. So there are people who are looking out for these kind of aspects as well. Lot of work to do at the epidemiological level as well. The data for epidemiological work in India and as far as the oral health is concerned, uh, I would say is limited. It is there definitely for where the focus of the government lies, but for the parts where the focus of the government does not lie, for example, in prosthodontics, the epidemiological data is very, very poor. So we can work, we sit in colleges which are in rural areas, we can work towards multi-centric research work, collecting data, providing data, in fact, to the government that, look, this is the problem. There are so many dentulous people, there are so many partially dentulous people. So that can help in coming out with policies and things like that. So that part takes care of the epidemiological research. There is the
Mm,
other end of research which talks about clinical trials. So some part of it can focus on that as well. Now I'm going to start working upon an artificial salivary substitute. It's a pharma company which is trying to develop a salivary substitute, and they would want people to, out there to, of course, lab testing they are doing, but they would want someone on the ground to actually test it on patients. So there is an aspect of clinical trials which is opened. If not from the pharma, some new technique, some new material which comes out in the market can be researched upon, can be worked upon. If not in the confines of your college, maybe in your clinics also, so long as you get an ethical clearance from somewhere, you can
mm,
focus on a particular, at least survey based epidemiological studies can be taken up at the clinical scenario as well. So there is a lot of aspects. Artificial intelligence is the new buzzword in research work. A lot of funding from ICMR comes when you talk about artificial intelligence, and there are a couple of people who have developed these kind of devices which work upon artificial intelligence and early diagnosis of cancers.
mm,
So I mean to say there are a lot of areas in which you can work. It's just about igniting that little spark and seeing what you wish to do. Not only research, let me just lastly highlight the significance of innovations. When we simply see research, it stops at research. But let me tell all those who are listening to this that innovations is the next step which the government is aiming at. We want patents, we want new devices, we want new softwares, we want a lot of this new words which comes as innovations. So there are the government has equipped colleges, institutions, universities to encourage students to come out with newer ideas, those
correct.
ideas which can be patented to develop medical devices and solve problems at the ground level. So that is the next step that one can take as well, because
Mm.
innovations and research go hand in hand. So all in all, I can just say that there is a lot to do out there, and slowly and steadily one who gets into it understands how to maneuver their way through and find and battle all those hurdles that follow in between. So I hope I am able to at least encourage a few to take up this exciting world of research.
No, no, I think it was fantastic. And thank you so much for your time today. I know you have a very busy schedule, but I think it was a very interesting conversation. And I'm going to catch you again and again in the future for such more chit chat, because it was a mind blowing session. And I think all the ideas, right from the challenges, the way you have solved, the way you do your bit as an individual, I think if we can create more individuals like this, I think that's what it can be, a game changer. And the insights that you provided at the end, like the different areas where actually people can think, I mean, dentists, dental students, researchers can think to So that perspective is fantastic, and I think it was very good talking to you, and thank you so much. And that's all today. I think we need to wind up at this moment, and I will meet you again. So to all my viewers, I think you got lot and lot of value if you are watching this particular session now, or if you are watching the recorded version as well. So in between watching, if you have any questions, please put it in the comments. I will make sure to pass it on to Dr. Pragati, and you will get your answers as well. So thank you so much once again, Dr. Pragati, for being on Eclectica, and we'll meet soon again. Thank you.
Thank you. Thank you so much. Thank you.